Now, for the next issue we'll get to look at as related to developmental abnormalities in the vagina, we'll look at the agglutination of the labia minora, or they call it the labia vulvar adhesions. Okay, labia vulvar adhesions, or agglutination of labia minora. So can you see this? This is a normal anatomy. You see the vagina and all of that. So, but for the adhesions, the opening is not wide down. Okay, there's a closure down. I seen it. Okay, so labial agglutination, also known as labial adhesions, or known as vulvar fusions, also known as synechia vulvae. So you can see that a lot of names are there. Okay, so it refers to partial or complete fusion of the labia minora. Okay, so the inner lips of the vagina are fusing. It's not opening like the normal one. You understand? So what causes it? Low estrogen levels, vulvar inflammation over time, traumas or infections, postpubertal cases may result from surgical procedures, sexual abuse, also conditions like bacterial disease, Basset's disease, lichen, sclerosus, just any skin issues. Okay, but sometimes cultural practices, so female genital cutting can also lead to labial agglutination. Okay, so what does it look like? There's a thin, whitish or grayish line between the labia minora. It's not open. Okay, so it may cover the vagina partially or completely. Okay, severe cases, the urethra may be obscured, so that person will even have issues trying to urinate. Okay, so symptoms: difficulties urinating. You have infections that are always coming back after you treat it. Okay, vaginal discharge or inflammation of the vulva and the vagina. So pain or discomfort, during activities. So in adults, they can have pain when they are trying to have sex. Okay, so diagnosis is made by visual inspection. You just can see it outside. Okay, so you see that it's important to differentiate from imperforate hymen, differentiate from vaginal agenesis, differentiate from transverse vaginal septum. Okay, so treatment, sometimes it can resolve spontaneously once they hit puberty, or sometimes you have to actually topically use estrogen, because low estrogen levels is one of the issues. So you can get estrogen creams and apply. Okay, so sometimes they now have to go into a surgery where they can manually recorrect or reconstruct that area.